Hey guys, Dr. Krautsack here, and today I'm going to talk about two misconceptions that I often hear in my office. Right, patients always ask, is chiropractic safe? I heard it was dangerous. I heard I could hurt my neck, break my neck, stroke out my neck. I've also heard that I have to come back forever and I have to keep getting adjusted, or it doesn't work, right? And so this is a little misleading in general, just the way some people ask these questions. But I always tell people, if someone's telling you this, right, and they haven't actually looked into it themselves, they're just trying to spread the crap around, right, or they're intentionally trying to mislead you. And so I've had patients come in scared of having a stroke, and the reality is if your chances of having a stroke or having any serious event in a chiropractic office is slim to none, right? It's literally 1 in a million to 1 in 2 million who have a better chance of getting struck by lightning. And I'm happy to answer any questions at any time on any of these issues, right? But just know the numbers. I'm happy to even post some links in the video. Feel free to ask questions. But the truth is, for you to have any kind of issue in a chiropractic office, right, typically for most people, right, they typically have an issue coming in. And I have many examples of this in real life. I worked in an office in Atlanta where somebody came in having a stroke in progress. And the CA noticed it. They saw the drooping of the face, the slurred speech. They recognized it. They were well trained. Notified the doctor. The doctor notified the emergency medical services. The ambulance showed up, took them to the hospital, and literally saved this woman's life. And I always ask people, I'm like, hey, do you think this doctor got a medal? And the answer is, of course not, right? The doctor did what they were supposed to do to get the patient well and make sure they're in the right place. They did their job. The problem where the doctor gets in trouble is when they don't do an appropriate exam, they're not paying attention, and someone comes in with a broken rib or a punctured, punctured lung, they're having a stroke in progress, they had a horrible head trauma and they have a dissection in progress, and then they put an additional force into the spine. And while it may not have caused it, it could have definitely triggered it. And these are the situations where we hear these kinds of stories, right? And so I'm not saying you shouldn't be safe. Definitely communicate with your doctor, but don't be afraid to go to the chiropractor, right? Chiropractic saved my life. It can save yours. It can help you reduce pain, improve function, improve your quality of life significantly. And I don't want you to miss out from that because someone gave you bad information. Misconception number 2 is that when you go to a chiropractor, you have to go for the rest of your life, right? And I'm going to tell you right now, if you come to my office, you can stop whenever you want, right? We'd love for you to come back. We'd love for you to focus on health and function, improve your health every day for the rest of your life. I always tell my clients that every day you're either building health or building disease, right? With every decision you make, you're either eating healthy or you're not. You're either going to the gym every day or you're not, and exercising or you're not. Everything you do for your health, you're going to do for the rest of your life, right? And the biggest contrast to this, the thing that frustrates me the most is I have patients who come in, they've been on statin medications for 20 years. They've been on their thyroid medications for 30 years. And I always ask them, hey, does your doctor have a plan for this, right? Have you looked at your medications? Have you plugged them into drugs.com? More often than not, I have patients come in 6, 8, 10, 12 different medications. We plug them in drugs.com interaction checker, and they have multiple serious interactions. They're drugs that shouldn't even be taken together, but they have several different doctors that are giving them medications, and these are medications that they're told they're going to be taking for the rest of their life. And so I always tell people, hey, if you're going to do something for the rest of your life, let's do something that's going to get you healthier. Let's get something that's going to improve function, get you stronger, healthier, improve your performance, and give you a high quality of life in your older years, because all these little things add up, right? And whether it be taking medications every day or getting adjusted occasionally, eating healthy, right, putting good foods in your body, right, the decisions you make are ultimately going to lead to your health outcome of your health in your older years. Thank you so much for watching. Hopefully this was helpful. We'll see you in the next video.